Good morning, all. Once again, a pleasure meeting you virtually. Today, I'm going to talk about an interesting condition known as Rhinitis Medicamentosa. What does this medical jargon mean? It means rhinitis, as I said earlier in my video, rhinitis is irritation of the nasal tissue. Medicamentosa is a condition caused by overuse of certain medications. Now, when people have nose block or when they have rhinitis because of other causes, they start using nasal decongestant drops such as Otrivine, Nasevion. There are Xylotop. There are so many. Okay, so people start using that gives them good relief. What happens? Because of chronic irritation, the nasal tissues are all going to be swollen, and the need for the drops is going to keep on increasing. Initially, it will be for 2 or 3 times a day. Then eventually it comes to 6 times a day. Then eventually reaches a stage where every 2 hours they have to use. Sometimes even every 1 hour they have to use. If they don't use, then it will lead to further congestion, what we call as rebound congestion. Now, why does this happen? Because when you put the drops, it shrinks the tissue, and then the tissue comes back as normal once the effect of the drops is gone. So when you keep on getting used to it, then what happens? You get adjusted to the dose. So the medicine, whatever you have been taking, is not enough to keep the tissue kind of decongested. This is not a good condition because that's going to lead lots of problems. One, it is going to give to dryness of the nose. It can lead to bleeding. It can lead to, because of the nose blockage, it's going to affect your quality of life. It is going to affect your breathing, and it can even affect you psychologically. So, if you are a person who has been addicted to nasal decongestant drops, the first thing you have to do is stop it, go meet with a specialist who will be able to guide you. Okay, so generally, if it is not very bad, I try medications to make the patient come out of it. But if it is very bad, then surgery becomes inevitable. But please stop using this nasal decongestion drops over a prolonged period of time. Okay, I always give my patients these drops if they have an acute condition, not beyond 4 days. Maximum will be 5 days. I don't give beyond that. Let it be children or let it be adult, because you really don't know why your nose is getting blocked. Whether it's because of the tissues in the nose or whether because of problem in the back. And for you to get used to it or are addicted to it, it's not a good thing. So I hope this video was useful. And until we meet again, thank you.